Okay, so we are going to be working on the CMC abduction of the thumb. Following an injury, the patient has a limited abduction, so we're going to work on increasing that. So we are going to be working with a convex metacarpal on a concave trapezium, and so the roll and slide are going to be opposite. And so working on abduction, we're going to be applying a posterior glide. And so to do that, I'm going to have the patient's shoulder flexed and elbow flexion. The ulnar components are going to be stabilized on the table, and her wrist is going to be in neutral. The open pack position for the carpal metacarpal joint for the thumb is just a nice relaxed position. So that's in between flexion and extension and ab and abduction. So just a nice neutral position. And so I'm going to be stabilizing the wrist and the trapezium while grasping on to the metacarpal. So first I'm going to be distracting to assess the joint mobility. So I'm going to distract, asking the patient, do you have any pain with that? Okay, no patient there, so we can move into treatment. And so for grade 1, I'm going to distract and move or oscillate before I feel any resistance. For grade 2, I'm going to distract and move into the resistance and back slowly. Now, because we're following an injury, that's probably where she'd feel pain. If she did feel pain, I would stop. If she did not feel pain, I could move into a grade 3. And so for that grade 3, I'm going to distract and move into maximal resistance and move back to the beginning of resistance. Max resistance, beginning of resistance. Nice and slowly. And then for grade 4, I'm going to distract, move into maximal resistance, and oscillate in that position. And that would hopefully increase her abduction. Okay, we're going to be working on the hold relax technique to lengthen her forearm supinators. And so to do this, the patient is going to be supine with the humerus stabilized and elevated on a towel. I'm going to be on the affected side. Right now I'm sitting. I could also be standing. And so to get the patient in the correct position, I'm going to be stabilizing the humerus with my top hand. I'm then going to be grasping onto her wrist. I want to be making sure I'm grabbing at the bony prominences proximal to the wrist so that I'm not moving her hand. I also want to be sure I'm applying my force on the radius, moving on the ulna. So I'm going to bring her into pronation to assess the range of motion of those supinators. So maximally testing that. And so then once she's there, I'm going to move her into complete range of motion. I then want her to bring it into supination as hard as she can. So for 10 seconds, pull, pull, pull. 1, pull, pull, pull. 2, 3, as hard as you can. 4, 5, 6, 7, 8, 9, 10. I'll then tell her to relax and move her into the new range of motion. And again, go ahead, fight, fight, fight me. 2, 3, hard as you can. 4, 5, 6, 7, 8, 9, 10. Relax. Good. Into that new range of motion. And third time, go ahead. Fight, fight, fight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And that's our third time, so we'll be done there. Good. And by using this technique, I'm utilizing the Golgi tendon inverse stretch reflex to inhibit those muscles after a maximal contraction.